lower lobular breathing exercise. The purpose of this exercise is to practice the technique of breathing strictly into the lower portion of our lungs. Our lungs are divided into 3 lobes on the right-hand side and 2 lobes on the left-hand side. And through practice, it is actually possible to breathe into each of these upper, middle, and lower areas separately, independently. And that is what our purpose is for this exercise. When you begin to gain mastery over breathing into each lobe independently, then we will be able to tie breathing in all 3 lobes together in a complete breath. These exercises are done through the nostrils, breathing in and out through the nose. The hand placement is important for these exercises because of the fact that we don't regularly breathe into our segments of our lungs intentionally and individually. It's helpful to place your palms in the areas that I'm going to show you in order to concentrate your mind on breathing strictly into that area. When we do place the hands on these areas, we want to breathe just into these areas and keep the rest of the lung capacity as still as possible without letting air into these upper parts. The hand placement is as follows. You begin by placing your hands right on your belly in between the top of the pelvis and the bottom of the anterior rib cage. You begin to inhale for 1 to 2 counts here as you have your hands here. Then you slide them to your sides and continue the inhale for another 1 to 2 counts, trying to expand the sides of your rib cage in the lower abdomen. And then place the hands on your lower back, right over the kidneys, and try to expand the breath through the backside and expand the lung capacity, trying to push out through the back. As you exhale in the reverse order, beginning to exhale from the back, then the sides, then the front. So when you do this breath all together, it will be like this. Inhale, inhale here, then exhale, exhale, exhale. Again, try to keep everything from here up as still as possible and just breathe into the lower lungs. I'll talk you through it once as you practice, and then I will do it with you for 3 rounds. Let's begin. Place your hands here, and on my mark, begin your inhale. Ready? Inhale, 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 exhale, exhale, exhale. Good job. Now I'll do it with you. One more. And relax. Good job.